In the second section of our lecture, now we will discuss about the pathophysiology of acute bacterial meningitis. And in this section, we will talk about some neurological manifestations of the meningitis. Also, the induction of inflammatory response, and then the early stages of meningitis, how the infection progress, spread, and where the colonization occurs. So all that we will discuss in the second section of the lecture. The pathophysiology of the acute bacterial meningitis, the common causative organism, we already talked about the common causative organisms of bacterial meningitis in detail, and Streptococcus pneumonia is the most common. Then we have Neisseria meningitidis, then we have Listeria, and then the Staphylococci. Different microorganisms can cause meningitis. So common causative organisms, we have Streptococcus pneumoniae, which is about the 50% of the cases. Then we have Neisseria, which is about 25% of the cases. So both of these organisms are about 75% of the cases are because of these two microorganisms. How they now begin the process of meningitis by attaching first to the nasopharyngeal epithelial cells. So epithelial cells of the nasopharynx they attach to the epithelium of the nasopharynx. And then what happens? They colonize the nasopharynx. In the nasopharynx, these microorganisms, they grow and they colonize this area. Then after that, they are transported across epithelial cell in membrane-bound vacuoles. In membrane-bound vacuoles, they transported across the membrane of the epithelial cells. Now from their epithelial cells, now they move to intravascular space in between in the vessels, intravascular. So in the vessels, they are transported from the epithelial cells. From there now they create separations in apical tight junctions of columnar epithelial cells. Then they move into the bloodstream, able to avoid phagocytosis. So once they reach in the bloodstream, it means they escape the destruction or phagocytosis. Then they reach the intraventricular choroid plexus. From there, they directly infect the choroid plexus epithelial cells, and then they gain access to cerebrospinal fluid. So all these are the steps that ultimately lead to the microorganisms Streptococcus pneumoniae and the Neisseria, how it attaches to the epithelium of the nasopharynx and ultimately reach to the cerebrospinal fluid. And once it flows or it moves in the cerebrospinal fluid, then it can access the meninges and different parenchyma of the brain and cause infection of the brain. So that's the mechanism how it spread from the nasopharynx to the cerebrospinal fluid. Next, we have the pathophysiology. We talk about the Streptococcus pneumoniae. Again, remember the most common organism that can cause the bacterial meningitis. It adheres to the cerebral capillary endothelial cells. So now what's happening once it reaches the cerebrospinal fluid, now it adheres to the cerebral capillary endothelial cells. migrate through or between cells to reach cerebrospinal fluid, multiply within the cerebrospinal fluid, and no effective opsonization of bacteria. Opsonization means attaching the organism with the phagocytic cell to destroy the microorganism. So once it reaches the cerebrospinal fluid, there is no effective way of destroying this organism, and then it can access to the site where it can cause infections. Phagocytosis is impaired. So that's the complete pathophysiology, how these microorganisms extend from the nasopharyngeal epithelium to the cerebrospinal fluid, and they escape the phagocytosis and how they access there. So that's the pathophysiology, normal way. Now the pathogenesis of the meningitis. Critical event is inflammatory reaction induced by bacteria. One thing we should remember, that once there is any inflammation or infection, the body fights that infection by initiating the inflammatory response, inflammatory reaction against that infection. So inflammatory reaction is induced by the bacteria that is accessed into the cerebrospinal fluid. So then there are some neurological manifestations which result from the immune response. Neurologic injury progress even after CSF is sterilized by antibiotic therapy. So the inflammatory reaction comes into action as a result of the bacterial invasion, and this can cause neurological manifestation. Even the cerebrospinal fluid is sterilized, or it's free of the microorganism, or even by the complete eradication of the microorganism by the antibiotic therapy, it keeps on progressing as a result of that inflammatory reaction that is started by the causative organism or bacteria. Next, induction of inflammatory response. This is how the inflammatory response occurs as a result of the bacterial invasion. The lysis of bacteria, or the death of the bacteria, causes release of cell wall components in subarachnoid space. Then what happens, there is formation of purulent exudate in subarachnoid space, induction of meningeal inflammation, production of inflammatory cytokines and chemokines, increase in CSF protein concentration and leukocytosis, increase in the white blood cell count, production of excitatory amino acids, synthesis of reactive oxygen and nitrogen species, and then this induce the death of brain cells. So that's the inflammatory response. One by one, there is, with the death of the bacteria, there is release of these chemicals, and that release of the chemicals like cytokines, chemokines, they have their effect action, and there is increase in the level of proteins, leukocytosis. White blood cells are increased in the area where there is inflammation, because the function of the white blood cell is to protect the body against different foreign invaders. There is production of amino acids, and there is active oxygen and nitrogen species synthesis, and all that can cause the death of brain cells. So as a result of infection, as a result of inflammatory response in response to that infection, ultimately the result is the death of the brain cells, because we know that even once the cerebrospinal fluid is clear of microorganism, even with the treatment by the antibiotic therapy, this response has to take place that ultimately cause death of the brain cells. Next, what are different chemokines and cytokines produced by the inflammatory reaction or response? We have a high level of cerebrospinal fluid. Chemokines and cytokines cause the tumor necrosis factor and interleukin 1 act synergistically, and they cause increased permeability of blood-brain barrier, induction of vasogenic edema. This edema, as a result, causes leakage of the serum proteins. Exudate and leukocyte obstruct flow of cerebrospinal fluid, and then we have obstructive and communicating hydrocephalus and concomitant interstitial edema. That's how the cytokines and chemokines, which are released as a result of inflammatory response, cause obstruction, cause edema, leakage of serum protein. So this is the mechanism how they function or how they act. Then inflammatory cytokines, which are, they upregulate the expression of selectins, which promote the leukocyte adherence to vascular endothelial cells, migration into cerebrospinal fluid, increase in the permeability of blood vessels, leakage of plasma protein, add to inflammatory exudate, neutrophil degranulation. Neutrophils are the white blood cells which are granulated. So once they are degranulated, they also release the chemicals. There is release of toxic metabolites, and this contribute to cytotoxic edema and cell injury and death. So basically, to simplify or to summarize what we talked about in these 2-3 slides is, as a result of infection, there is inflammatory response, and that inflammatory response causes production of cytokines and chemokines. These cytokines and the chemokines, they increase the permeability of the blood vessels. With the increased permeability, there is leakage of the proteins. There is increased fluid leading to edema and obstruction, and all these factors ultimately cause the cell death. So in simple words, that's the induction of inflammatory response as a result of the infection. Then early stages of the meningitis. We have what happens step by step in the meningitis. First, there is increase in cerebral blood flow. The blood flow to the cerebrum or the brain is increased. Subsequent decrease in cerebral blood flow. So first there is increase, then there is decrease. Loss of cerebrovascular autoregulation. How these blood vessels autoregulate the flow, that is lost, that is affected. And then there is encroachment of purulent exudate, narrowing of large arteries at base of the brain. So in the early stages, that's what's happening. Initially, there is increase in blood flow, then there is decrease. The autoregulation is affected. There is encroachment by purulent exudate and the narrowing of large arteries at the base of the brain. Then there is infiltration of arterial wall by the inflammatory cells, ischemia and infarction, obstruction of the branches of middle cerebral artery, thrombosis of major cerebral venous sinuses, thrombophlebitis of cerebral cortical veins, raised intracranial pressure due to interstitial vasogenic cytotoxic edema, result in cerebral herniation, and that's how it progressed. So all that is the pathophysiology of the meningitis, which we discussed in detail in our this second section of our lecture. So thank you for watching sqadia.com.